Hello everyone, this is Sourav from Naga Medical College, and today I would like to talk about drug induced dry cough. And first of all, we have to understand a patient scenario. Let's talk about a patient scenario. The first of all, a 54-year-old man is admitted to the hospital with a chest pain. Based on serial angiogram determination and of his electrocardiogram, he is diagnosed with a myocardial infarction. He is hospitalized for 3 days and recovers, but the left ventricular dysfunction remains. He is prescribed several medications on discharge. A week later, he complains to his doctor about the dry, non productive, and persistent cough. So, we have to find out which of the following medication is most likely responsible for the appearance of this symptom. So, option 1 aspirin, which is a NSAID. Then option B captopril, option C metoprolol, option D procainamide, and option E warfarin. So here we can see the option B captopril, and it is a ACE inhibitor, and we know ACE inhibitor is causes or one of the adverse effect of this ACE inhibitor is dry cough. So let's find out why it causes. Here angiotensinogen is converted to the angiotensin 1 by the action of the renin, and then is converted to angiotensin 2 by the action of angiotensin converting enzyme, and it's a renin angiotensin aldosterone system, and which causes increase the blood pressure. But if we use a ACE inhibitor, it's block the conversion between the angiotensin 1 and angiotensin 2, and by this action it produce antihypertensive effect. So in case of hypertensive patients, we can use this ACE inhibitor. But another action is ACE angiotensin converting enzyme also causes the excretion of the bradykinin by its metabolism. But when we use ACE inhibitor, it cannot excrete the bradykinin, and we know bradykinin is responsible for the dry cough as well as the angioedema. So that's why here as the adverse effect of the ACE inhibitor, dry cough is produced. So in this case, what should we do? Then we have to stop this ACE inhibitor drug, and we can start ARB or angiotensin receptor blocker. Thank you.